My name's Ruth Bromley and I'm a GP in Wythenshawe in South Manchester. I'm the chair of the organisation that is responsible for planning healthcare that you want, as well as being of good quality and value for the city. Working alongside Manchester Council, we plan health and social care, working with others to support people to lead healthier lives. Instead of a dull annual report, we're doing this film and getting out to loads of community events. So if you see us, please come and chat. David is one of our team.
Hello, I'm David Regan, Director of Population Health. This city has groundbreaking businesses, great green spaces, brilliant universities, plus a successful football team or two, and world-class health and care professionals working in top quality facilities, all supported by brilliant community and voluntary sector organisations. In some areas, health is improving. Manchester men live 2 years more in good health than they used to. But generally, the health of Mancunians is poorer than elsewhere. So we aim to improve on this, to make Manchester as proud of its health as it is of so many other things.
Hello, I'm Ian Williamson, Chief Accountable Officer. Making poor health statistics better is a big challenge, but we've made a start. More diabetics got full care checks. 525 more health checks for learning disabled people. More clinical checks on patients' lung disease and asthma. New, calm, welcoming unit for police to bring people in mental health crisis. Extending GP services to evenings and weekends. New services getting you safely out of hospital, and extra healthcare for homeless people, asylum seekers and refugees. We'll see all the benefits of this in the future, but we've met or beaten these targets in 2018 to 19. Less antibiotics prescribed, making them more effective. People getting mental health beds locally rather than out of Greater Manchester. Children seen promptly for eating disorders. Targets for suspected cancer patients seen and diagnosed quickly. People with common mental health problems being treated. And pregnant women getting one-to-one care giving birth. Quality of care is really good, but too many people still wait too long in accident and emergency, and for their first specialist appointment after cancer diagnosis, and aren't seen quickly enough when referred for hospital care or tests. However, we are all working hard to reduce these waits. An important part of our annual report tells you how we've spent our money and if we've managed it well.
Hello, I'm Claire Yarwood. I'm the Chief Finance Officer. In 2018-19, we got 950 million government funding for health services. This is to fund many different treatments, procedures and medicines, including care in hospitals, mental health needs or learning disabilities, medicines and equipment, GPs, community services like district nurses, nursing care outside hospital, and running our organisation. The rest goes on things like keeping people out of hospital and well at home. And we've passed all the government tests that show we're managing that money efficiently, effectively, and appropriately. We also work with Manchester City Council to oversee investment in adult social care and public health services.
But our finances are very pressured. Our population's growing and living longer, but with long-term conditions. And the cost of treating them goes up. So we'll keep working on new services and ways to provide care. Let's look forward.
Hello, I'm Dr. Manisha Kumar. I'm a GP in Rusholme and I'm also Medical Director of MHCC. Many causes of my patients' health problems can't be solved in my surgery. A rewarding job, good housing and clean air would all help. We think only 20% of good health can come from NHS care. The rest is down to other elements like education, employment, and how we live. And while we can't directly change people's individual circumstances, we can work with employers, schools, and housing teams to make those health connections. We'll also support people to make healthier choices, like giving up smoking, which we know affects health. And if you do need medical help, we'll make sure it's easy to get. We'll work with GPs so all patients get the same highest quality services at convenient times. And we'll keep people out of hospital, which must all work together with the full range of timely services. Next year, we'll focus on the biggest impact health conditions, making sure we meet all our community's needs, whatever their beliefs, culture, lifestyle, or where in the city they are.
So there's how we've done over the last year and our future plans. To get better, we need local people to help design services they need and tell us what works and what does not. Could you join us in that?
Please do get in touch if you want to find out anything else or to ask us any questions. Thanks so much for watching and listening.